Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, for wives-only seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. It's another Thursday evening, and we are back for the amazing Power of Woman broadcast. It is myself, Pastor Toyin Ogoye, along with Pastor Chooks Obina Ogoye, who are your hosts for today. And as we always say, this broadcast is born out of this book that we wrote, that Pastor Chooks wrote, The Amazing Power of Woman. Just if you would like to get a copy of this book, the number on the screen is how you can get information about getting a copy of this book. So we're glad to be back for our Thursday broadcast. Over to you, Pastor Chooks.
Well, welcome everybody. It's a beautiful Thursday evening. We had an amazing conference last weekend in August.
Yes.
Wow, what a conference. The Ever Victorious Woman. 4 days of impartation, 2 sessions a day. We had the Ask Your Gynae, then we had a session for the singles, then we had a session for the marrieds, then we had a session for breast care and bra fitting.
Yeah.
And it was just a very loaded conference, and so much benefit and blessings and value to the women who attended. If you missed the conference, I'm sorry you did, but you can catch up.
Yes.
The materials are now available. We have MP3 files and then MP4 files. MP4s are videos, MP3s are audios of all the 8 sessions. They are available now. So all you need to do is to contact us on the number on the screen, +27 81 421 0835. It's a WhatsApp number. Send a WhatsApp message to that number saying, I want the conference materials. And you will be guided on how to make payment and how we're going to send it to you. It doesn't matter where you are in the world. We will get it across to you. All right, so just send +27 81 421 0835. We handled so much at the conference. You know, there were teaching sessions every day in the first sessions, and then the second sessions were more interactive. Second session on the first day, we had the Ask Your Gynae session, where we had my dear friend, Professor Amaka Ocheke, professor in obstetrics and gynecology, join our resident gynecologist, Dr. Audrey Gugugamedze, and they handled a lot of the difficult questions. The theme of this year's conference, Ask Your Gynae session, is questions you are too embarrassed to ask your gynae.
And they broke it down.
The two of them are experienced gynecologists practicing in 2 different countries. You know, the one in Nigeria, the one here in South Africa. So they brought their experience. I mean, this one is a professor of gynecology. You know, they brought their experience, consultant gynecology, right here in our midst, Dr. Gamedze. It was such a rich session. Every woman needs to listen, watch those sessions, so that some of these questions, they are already answered for you. You don't need to ever have to worry about asking them again. All right, and then on the second day, there was the main teaching session, and then we spoke to the married women. Right? Yeah, the married women, how to be victorious, as a married woman. And then on the third day, there was a powerful teaching in the first session, and then the second session was a session for the singles, and it was so interactive, how to be victorious as a single lady. And then on the last day, there was a very powerful session in the first session, and then the second session was breast care. and bra fitting.
Yeah.
Quite informative. Quite informative.
Very,
Every woman, you need to get all those teachings. Anyway, we promised at the conference, because there were so many questions coming in, that we're going to have 2 sessions of Ask Your Gynae. Normally, the Ask Your Gynae is normally 1 session a month, which we have the last Thursday of the month. But because of the so many questions that were coming in, we decided to host 2 Ask Your Gynae sessions. So tonight, we are going to have an Ask Your Gynae session. Our resident gynecologist, Dr. Audrey Gugu-Gametse, tackling some of the questions that came off from the conference. So we're just going to hand over to Dr. Gameze right now, right?
Yes, we'll just introduce her, and then she will be coming on shortly after the introduction. Thank you.
All right, so we'll see you after when Dr. Gameze is done. Enjoy the session.
Yes.
Dr. Audrey Gugu-Gameze. Dr. Audrey Gugu-Gameze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gameze features monthly on our Ask Your Gynae show at the Amazing Power of Woman broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
Thank you. Just as Pastor has mentioned, this is an overflow of questions from the Power of Woman conference. I'll just dive straight into it because we've got so much questions. A lot of questions are asking around menses or around periods. I'm just going to read them just so that I can acknowledge all the ladies who sent our questions, and then I'm going to answer them all at once. The first question says, my period flow is very heavy. Is that normal? Second question, I get clots during my period. What does it mean? The third one, my daughter is 15 and yet to have her period. Should I be worried? Why has my periods become irregular since my tubes were tied? What does it mean to be bleeding in between periods? Is that normal? Should I be worried? And there's another one that says that my periods are irregular. What should I do to regulate them? Periods. Okay, let's start off by putting things into perspective. I always like to do that so that in that process we can know what is normal and what is abnormal. So menarche, which is around the time when a period starts, in the very first time or the very first time in a woman's life, is traditionally around the age of 15 to 18. But since the human species is evolving or changing in adaptation, nutrition, and so on, we are seeing girls starting from as early as the age of 9 to 12. So that is menarche. So we are expecting that at least the period should have started around that time. If it's too early, it's going to be 9. If it's late, it can be around the age of 18. So what triggers a period? It is the hormonal maturity in the woman's body. So because of adequate nutrition, because of the affluent life that we are living, and all other factors that we cannot account for, we are seeing girls starting at a much earlier state. And also, menses are a function of your body size. So if a girl is of a bigger body habitus, is most likely to start her periods earlier. Okay, let's keep our children's nutrition in check. Then, how long should a period last, or what is a normal cycle? According to gynecologists, when we speak of a cycle, we are speaking from the first day of a menstruation until the next first day on the next month. That is a cycle. That can take anything from around 26 days if your cycle is very short, and up to 35 days if your cycle is very long. So your cycle does not necessarily refer to the flow. Then, during that time, you've got the time that is called menstruation, which can be anything from around 3 to 7 days. If it is above 7 days, we consider that a very long menstrual flow, and it can be abnormal. It can also result in certain deficiencies in your body. The commonest one is iron deficiency. Also, if you've got bleeding tendencies, you may find that your periods come in and out of your expectation. And then the next phase after that is called the proliferative phase. That is when now the body is busy building up in preparation for a possible pregnancy or possible stay of the baby in the womb. Accompanying that will be the secretory phase. So in the egg basket, there is an egg that has been elected to form the next generation should that person fall pregnant. So that event where the actual seed in the egg gets expelled, that is the process of ovulation or the event of ovulation. Most women can sense that event, and also when it happens, it can trigger certain body changes. Some women will feel their breasts being much more fuller, their breasts being much more painful, and also the discharge changes, vaginal discharge, it changes. That event is called ovulation. If you are very sensitive, even your body temperature tends to be a little bit higher around that time. Then following that, it's gonna be the menstruation. So that forms the menstrual cycle. So girls, when you say cycle, please don't talk about the days when you are bleeding. Okay, so why is a cycle, when is a cycle normal and when is a cycle abnormal? Number one, a normal cycle will be a predictable cycle. I've listed a few things under being predictable. That number one, you must be able to tell when your menses are gonna come. Number two, you must be able to tell how long it's gonna be. Number three, you must be able to tell how heavy it is gonna be, such that even if I were to take you to a different place and you have your period, you should still be able to manage them because the preparation for it will be adequate. That is called a regular period. So it does not necessarily mean that your period will always come on the first. I've seen some ladies whom the period comes on the first this month, the next month it comes on the 30th, the following month it comes on the 29th, and they say it's irregular because it doesn't follow a certain day on the calendar. So if we bring logic home, if your cycle is 26 days and you start bleeding on the 1st of September, it means that on the 26th or on the 27th of September, you will be having your period again. That doesn't mean that you're having your period twice a month. All that it means is your cycle is a little bit shorter. It doesn't fit into 30 days. If your period is, if your cycle is 30 days and you start bleeding on the 1st of September, it means that most likely on the 31st or on the 30th, you will be starting your period again. But if your cycle is 35 days, then it means that if you start on the 1st of September, you are less likely to have your period again within the month of September. It's gonna be somewhere in the middle of October. Then if the month is short, like February now, February, say it's got 28 days that year. So if you start bleeding on the 1st and your cycle is 30 days, say you start bleeding on the 29th of January and your cycle is 28 days, it means that you are going to have your period a little bit earlier in February. But if your cycle is 35 days, you will miss February completely. That does not mean that your period is abnormal. So I always encourage ladies to keep a calendar. Now we're very lucky there's apps that can assist us in tracking our periods. Okay, that is about periods. So periods can be interrupted by a number of events. That can be weight loss or rapid weight gain. It can be interrupted by stress, Stress includes strenuous exercise. It can also include physical stress or emotional stress and any other form of stress, hormonal stress, that can result in your periods being abnormal. When I say abnormal, I include being unpredictable, I include a heavy flow, I include absence of periods. All those form abnormalities around periods. Then there's a cluster of heavy flow. There's a lady that says that they are heavy and they are irregular after sterilization. If we look at the makeup of the woman's reproductive organs, there are ovaries, which are the baskets that contain the eggs, and then there's fallopian tubes, which is what we clamp or what we tie during a sterilization. So that acts as a conduit where blood can move from one end to the other. So if we traverse that continuous blood flow, it can now result in either the womb having too much blood or too less blood. So that may result in one lady having a heavy flow after sterilization or a lighter flow after sterilization. Being irregular of a period, I always say that most women spend a lot of their lives on contraceptives. Let's take an example. If as a 12-year-old you're having very heavy periods, you're having very painful periods, you miss out on school and other crucial family events, the gynae is most likely to, in discussion with your parents of course, put you on contraceptives. So you find that you are on the pill from around the age of 10 or 15 up until you finish having your family. That lady will never know how her normal period is most likely to discover after sterilization when the hormonal guidance has been withdrawn that actually my periods are not so regular. And also ovarian cysts, they do cause irregular periods. In this case, I suspect that by irregular, she meant that they are no longer predictable, they don't come on time. So if you are used to the clockwork that hormonal manipulation brings, you are most likely to complain about your menses after you have had a sterilization. The phenomena of clotting. Clotting normally happens if the body is harmed. So if I were to cut you now somewhere, or you chopping cabbage in the kitchen, you sustain a cut, you will not bleed until Jesus comes. At some point in time, the bleeding will stop. It is the function of the clotting factors that is responsible for stopping that bleeding. So it is the same phenomena. If you are losing a lot of blood, the body switches on to the mode that no, we need to start saving now. When the body does that, then that is when we start seeing the manifestation of the clots. With the clots, the womb will feel like, it's heavier inside now. There's a lot of weight. I need to start squeezing out the more so that all these clots can come out. So now you're having a lot of pains because the womb is squeezing out the clots. You're passing a lot of clots because the body is trying to stop that torrential flow. So that is how we get clotting. We do need to have a manipulation. So most doctors will oftentimes start with treatment like Brufens. Brufens are easier. You can get them over the counter, which is the same component that is found in your Nurofen. That is what we use to manipulate the body to stop the clotting. Hence, your flow will just be flow of blood without the blood clots. What do we do to regulate irregular periods? Normally, if your periods are irregular, we need to find out why. That is the job of your gynae and of your GP. Most GPs are very good. If your periods are irregular, they will say, okay, let's just blindfoldly put you on the pill to try and regulate your flow. If your flow is regulated whilst you are on the pill, you are most likely going to stay on it. But if you want to find out why, then you are better off asking your GP to refer you to your gynae, so that at least we can check. Is it because your ovary is under functioning? Is it because there's no proper coordination between the brain and the ovaries? Or it is because there is some other factor that needs to be investigated. So now we want to know that if the daughter is 15 and is not yet menstruating, should the mother get worried? I would say, please do not be worried. As long as when you look at her, you can see the secondary signs of maturity. That will involve growth of hair under the armpit and in the genital area, where you can see the skin clearing or glowing or getting pimples. That is a sign that the body is undergoing hormonal changes. Breast development, it should be appropriate for that age. And also, mothers need to refer to themselves. Usually the apple doesn't fall very far from the tree. So you must also refer as to how long did it take you to go into your periods, also checking from the father's side. There is always a genetic component into the way we are timed in our bodies. What does it mean to be bleeding in between periods? Is that normal? Should I be worried? It is not normal. Should you be worried? Don't be worried, but do be concerned, and let's seek medical advice to find out why. Number one, there is a cluster that will bleed after physical activity or after sexual activity, those who are married, of course. And then there is a cluster that will just bleed out of the blue. If the bleeding happens after physical activity, rest assured there is a mass or there is something growing somewhere. That could be a fibroid, or that could be an ovarian cyst which gets irritated around the time when you have that physical activity. Bleeding after intimacy could be a sign that there is inflammation around the mouth of your womb or inside the vagina. That needs to be checked. Any form of inflammation on the cervix can be due to, number one, changes that are due to infections. It can also be due to changes that are brought by precancerous changes. It can also be due to maybe it was a traumatic encounter, so it needs to be checked. Then if it's bleeding after intercourse, it can also be because you've got fibroids. They get irritated during the act of intimacy. Then fibroids are the main thing that we are seeing in our practice. They do cause abnormal bleeding. Ovarian cysts do also cause abnormal bleeding. So if you are bleeding or if you are having irregular, having bleeding in between your periods, like she has put it, then we need to check why. We always try to exclude common things before we start thinking cancer. In the reproductive age, I must say, cancers are very, very uncommon. But if you do get a cancer in the reproductive age, it's most likely to be cancer of the cervix. So girls, let's get out there and do our pap smears so that we prevent cancers of the cervix. Okay, that was around periods. If there is a question that you've submitted and I have left behind, I'm sure that by just explaining how the menstrual cycle works, you've managed to pick up something to answer around that question. There's somebody who mentioned a question on how much the blood should be. I don't know. It is always a function of your genetics and also how you tolerate blood. So from a gynae's perspective, if a lady comes to me and says that my periods are heavy, I always ask a few questions. Number one, how many days do you bleed? Number two, do you get clots when you bleed? Number three, what size pads do you use and how often do you change? Do you wake up to change at night? Do you need to use extra linen to protect your bed? Then from there, I can sort of have an idea that it is a heavy flow. The last objective way to know whether your period is heavy or not is how you feel after the period. If you feel drained, and if you've got relatives who are sensitive, they'll tell you that you even look pale, then that is significant of a heavy period. It means that you actually bleed out during that period. So that needs medical attention. I wish I could even do all the medical consultations on the screen. That would be very nice. But I'll still keep on saying, please consult your doctor to make sure that you get help. Okay, let's go to breasts. The question one says, do I need to have my entire breast removed if there is a cancer? The second one says, I hear the breast can be reconstructed. Is that true? Okay. The breast was taken away from the gynae by the surgeon, and I think the surgeons then were males, so they enjoyed working around the breast. But anyway, I'll tell you what I know about the breast. I always say that every time you get to your gynae, please make sure that they do examine your breast. And if you do not know how to, if you also don't know how to examine your breast, please do ask them to show you how to examine your breast. They are best examined around the time when you finish your period. So you finish your period, any time from then you can examine your breast. So the breast is usually cut into 4 quadrants. So imagine a circle and you draw one line going down and one line going across, the center being the nipple. So regardless of the shape of the breast, you can still divide the breast in that manner. So what you do is, in circular motion, you feel around the breast. So each space, you feel it in a circular motion. What you want to feel for is, are there any lumps there? And also you want to know, is there any painful area? Then you also squeeze the nipple to check, is the nipple having any blood? Or is in the nipple having any, is there any pus coming out? Then you need to also go up towards your armpit, the axilla. In the armpit, it's gonna tell you now if there are any lumps. So the breast drains into your armpit. So from that, you can be able to say, okay, my breast is normal, or my breast has something that I'm not used to. So please, ladies, let's touch our breasts. Let's be the ones to say there's something in my breast, not to say, my partner says that there's something on my breast. So please, let's be active in doing that. So there are certain disease conditions that if when they happen on the breast, they necessitate either a cut around the skin or a cut deep into the breast to take out any tissue that is abnormal, or you find that the entire breast is being removed. Let me start by the small skin. The small skin is called a biopsy, excision biopsy, whereby now the doctor wants to know. They can either do a core, which is when they cut like when you're making scones, or they cut out, or they remove the whole breast. So that is to check that from what is abnormal, what is the cause, and what can be done to it. If they need to remove a lump, they will open up and remove the whole lump out for tests, and also that will be a form of treatment. If there is a cancerous growth, the doctors will extensively discuss this with you, and a decision will be made whether that is necessitating removal of the entire breast, or it necessitates one part of the breast to be removed, or it necessitates that both breasts be removed. That is called mastectomy. So the question says, do I need to have my breasts removed if there is cancer? Yes and no. That whether the whole breast is removed, it depends on the kind of cancer, number one. Number 2, it depends on how far it has gone. Number 3, it depends on how easy it is to monitor that kind of a cancer. If it has spread widely, they can remove the whole breast. If it is a small cancer but difficult to detect and difficult to follow up, yes, they may opt to remove the whole breast. But if it is a cancer that is very slow growing, and also when they do the biopsy, it shows that it is very sensitive to the kind of treatment that has been chosen, then there's no need to remove the whole breast. But I always say that as women, we need to be sensitive to our genetics. That is, know what cancers run in your family. We know that more especially in our indigenous ethnicity, we don't talk about diseases that run in our generations. So make it a task upon yourself to find out what cancers run in our family so that you can be able to surveil and manage yourself. Then the no part has been answered already. Some cancers are very slow. They can be monitored, or if you remove that part that is affected, it's already sorted. Then I hear that the breast can be reconstructed. Is that true? It is very, very true. So traditionally, before we had what we call the prosthetics, we used to get tissue from somewhere in your body. If you are well nourished like me, they can get some fat tissue from your thighs, some fat tissue from your bum, some fat tissue over your tummy, and they bring it up towards the breast, and that can give you sort of similar breast. And if they need to reduce the breast, they do the same thing, half the fat. Breast is mainly fat. They half the fat and then they close the skin nicely so that it doesn't show that something was done to it. If the whole breast has been removed, we can get an implant. So in that case, you have to choose what size bra you want to wear. Say maybe the whole breast has been removed and you want it the same size as the surviving one. Then they can get an implant that will fit that. Implants can be put under the skin, and then you can also get some soft pads that you can put over the skin. That is if you want cosmetics when you are dressed up. But if you want to be cosmetically approved to yourself when you are undressed, then the implant can be put in under your skin. So yes, it's true, breast can be reconstructed. My time is just running far away from me. Let me just take this one. Why do I keep getting bladder infections? Okay, when you measure the urethra, that is the pipe that takes wee out from the bladder of a woman down to the outside, that is about 3 centimeters. That is enough time for germs to crawl from outside, that is in the vaginal area, up towards the bladder. And then there are certain conditions that predispose women to bladder infections. Bladder infections can come about if you've got poor toileting hygiene. When I say poor toileting hygiene, I mean that when you get to the bathroom, instead of wiping from the front towards the back, you wipe from the back towards the front. And also when you rapidly gain weight, it's difficult to maintain hygiene than somebody else who has always been a plus size. So that will predispose you to bladder infections. There are also some instances like pregnancy. You are more likely to have more bladder infections when you are pregnant than when you are not pregnant. That's basically because the pregnant womb or the growing womb keeps exerting a lot of pressure on your bladder. So when you go to pee, the bladder cannot empty completely, because as soon as it is just collapsing about to be empty, the womb falls on top, and then you get a lot of wee remaining behind. Instances also like menopause, where the gatekeeper towards your bladder is getting weaker because it's estrogen sensitive. That can also predispose you to recurrent bladder infections. And then this I'm somehow about saying it, but it is a reality. We are encouraging ladies who do not want to have babies to contracept. But a certain class of contraceptives, which is the progesterone only, that will involve your injectables and also the Mirena. They are much more favoring bladder infections because they are low in estrogen, or they do not have estrogen, so you rely on the estrogen on your body, yet the levels of the progesterone are very high. So that will keep your vagina, your bladder very dry, and that will predispose you to bladder infection. So ladies who get a lot of bladder infections, I always encourage that the important thing is drink lots of fluid, practice good toileting habit, keep the urine alkaline. So you can take citrus soda, it helps a lot. Cranberry juice helps a lot. And then in cases where the infection surpasses all of those measures, you need to see a gynecologist or a urologist. You can be put onto long-lasting course of antibiotics, which is called prophylaxis, and that works very, very well. Some ladies also think I have a bladder infection, yet it is an entity that we call an irritable bladder. That is a bladder that as soon as it starts opening up, that it's filling up, you start getting a feeling that you are so pissed that you need to go and wee-wee. And when you get to the toilet, you find that it's only a very small volume that comes out. In that way, a urologist can do a biopsy and tell you the diagnosis of an irritable bladder and treat you. Wow, that is how much time I have for today. But don't forget, we've got another session coming up where we're going to take more of your questions. God bless you.
What another informative session we have had, Dr. Gamedze. Thank you so much for answering those questions and tackling it and giving understanding around the questions for today. We've just had another beautiful one, Pastor Chicks.
Dr. Gamedze, we are grateful for your ministry, for your commitment to the women, for coming along with us to minister to women.
Yes.
Your knowledge of gynecology is amazing. I've been saying it, you need to start your own medical school. Thank you so much. Thank you for sharing and shedding light to those questions that the ladies have sent in. We know that there's still a few more questions and we couldn't go through all of them because of time. We are going to handle them on the 30th of September, the last Thursday of September. I think Thursday the 30th is actually the last day of September. So we're going to, that's 2 weeks from now, we're going to have another session to tackle all of those questions from the conference. But for tonight, we have taken so much that we can take for tonight because of time. We want to say a blessing over you, a blessing over your body, a blessing over your mind, a blessing over your family, over your health. We declare in the name of Jesus that the hand of God rest upon you to keep you, to preserve you until we see you again at the next Ask Your Gynae session on the 30th of September. Until then, God bless you. Enjoy the rest of the evening.
Bye.